Hi, my name is Cassandra Miller, and I am here today to teach you guys a little bit about cognitive behavioral therapy, which is also known as CBT. Do you or someone you know suffer from the feelings of being depressed or anxious? Do you also know anybody who is currently suffering from an eating disorder? Or how about anybody coming back from being overseas, suffering from post-traumatic stress disorder? Well, cognitive behavioral therapy, which is also known as CBT, can greatly help these individuals. Cognitive behavioral therapy focuses on 30 to 60 minute sessions with a therapist in which you are either in a one-on-one session or they also have group sessions as well. And they focus on helping the individual think things a little bit clearer and help their overall thinking to come out to be a little more positive. During the client's first initial session, it's best that they get to know their therapist. Make sure their therapist is the right fit for them. A lot of clients have different issues, and a lot of therapists have different ways and techniques of helping their clients cope in different situations. A client can, come up with some questions for the therapist, and they can keep those in the back of their mind. And as the therapist is talking to them during their session, the client can think of these questions that they have, and hopefully during that session with the therapist will answer these questions without really knowing that the client is quizzing them on whether or not they're the right therapist for them. There are a couple of steps in cognitive behavioral therapy. A client needs to identify what kind of situations are in their life, what has brought them in to seek the treatment, like the feelings of being overwhelmed from stress. Is it work related, family related, what's going on? They also need to be able to identify the negative thoughts that they have in mind, be able to push those aside and to be able to reel in some more positive outlooks that the therapist will help guide them through. Now, the length of these sessions could be anywhere from 30 to 60 minutes long. They could also be a couple of times a week. So one of the setbacks to CBT is that most of the CBT clients will need to have a pretty open-ended schedule to be able to come in for these sessions and get the therapy that is much needed for them. Family support is huge with cognitive behavioral therapy, because not only will your thinking affect your therapy sessions, but it's going to be something that the client's going to live with on an everyday basis. It's going to be something that they bring home. So the family needs to be supportive as well, and let the client know that they support them 100%. During these cognitive behavioral therapy sessions, everything is kept confidential. Now, there is a few times where the therapist will have to break that confidentiality and step outside the box. Now, those are very rare and don't happen very often, but if a client does mention anything about self-harm to themselves or harming an individual, such as a family member or a friend, steps definitely need to be taken, and action needs to be taken as well, and the therapist needs to get the ball rolling on that, so no self-harm or harm for anybody else is done on that. A few setbacks to CBT could include that the therapy is a little costly. So, a person wants to make sure that financially they are to the point where that's something that they can afford and they are fine with it. Also, the sessions lasting a couple of times, the client needs to make sure that they are open for these sessions as well, making sure that they have free time for these sessions. Now, cognitive behavioral therapy has many advantages that outweigh the negative parts of it, and I am going to talk to you about those now. Cognitive behavioral therapy can be almost as effective as medication, if not just as effective as medication in some cases. And I work at my hometown hospital, and I have seen many patients' medications list, and those medication lists can be lengthy. So to cut back on a medication, if at all possible, can be extremely helpful to the patient. Also, with cognitive behavioral therapy, the ideas and the way that the therapist is going to help the client rethink things is not just something that they will keep with them during these appointments. It'll be something that will be with them for the rest of their life. So regardless, once they leave the session, their basic day-to-day, everyday life is going to be much better. Their way of thinking is going to be more positive, and they're just going to have a more positive outlook on life and hopefully be able to live a beautiful life. The founder of cognitive behavioral therapy was Aaron Beck. Now, Aaron Beck founded CBT back in the 1960s while he was studying at a university in Pennsylvania. His approach showed that patients were able to think more clearly and to understand things much better in the long run, which, like I said, to be able to think more clearly and to understand things better than what a client would have been able to understand things does help a patient or a client live their lives much more clear. To this day, there have been over 1,000 cases of CBT, and they've been proved effective. So to this day, cognitive behavioral therapy is still used, and many patients still do. It's definitely a positive therapy for some patients and clients, and it's definitely a good outcome for these clients as well. Thank you.